Well, we'll go ahead and call the meeting to order. Start with the pledge. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, liberty, justice for all. Thank you. Lord, we come again today, Father, to be within us around County. Lord, we trust, we ask, and that we believe that you will give us a measure of wisdom to handle ourselves with dignity, respect for others, Lord, but always with mind and a spirit that wants to bring out the best for the people that are, Father, the words we say here today may not be remembered long, but some of the things we do may. So let those be good things that benefit the most people. Be just in one pray. Amen. All right. Welcome to the Monday afternoon meeting. All right. First thing on the agenda is county personnel or public comment. Is there any? I don't see any, and I'm gonna take about a minute here. So, we had this project with the banners outside the courthouse and the city streets, and the commission and the people in this room, most of us played a role in this, albeit some of us was a smaller role. And one guy played a pretty big role in it. So I want to make sure that while we were totally supportive of this thing, the ramrod behind this program was Mr. Tesoro, and it really turned out nice. And we've already, we got a couple of compliments today. It just really enhances the courthouse square in the city. So I just, thanks for pushing on that and doing all the legwork and running back and forth to Holden and everything you did that we don't even know about, because it really turned out nice. So appreciate it.
Well, I'm just glad that the people that live in Brown County responded so well. Unbelievable response, and everybody reacted quickly. So that was nice. We had a deadline of trying to get these things up by July 4th, and we are going to meet that deadline, which I think is important. When you set a deadline, you meet it.
Yeah.
So,
well, it looks so nice.
Thank you. Appreciate it.
Okay, is there any other county personnel or public comment? And if there isn't, if we're still in session and you need to say something to us, we will make time for you. Okay, the first item on the agenda is the minutes for last week. So we've got a couple of them, be the work session and the actual meeting. Are there any additions, corrections, or comments to the minutes as they were presented?
I don't have any. With Bill going through with the fine tooth comb, I went back and I thought for sure I was going to find something. I think you did a good job. Obviously, there's no spelling errors, nothing like that. I have no problem with the way they're presented.
I move we approve the minutes for June 15th.
I'll second it.
Okay, the minutes we had the
Nope.
the 8th and the
No, June 8th. Sorry.
June
8th and the 11th, I guess would be the work session.
Right.
Can we do them both?
Yep.
Okay, so we have a motion to approve the minutes for the 8th and the 11th. Is there a second?
I'll second.
It's been moved and seconded. Any discussion? If not, all in favor say aye.
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 Okay, motion carried. That's done. Item number 2 is payroll for the 10th of June. Are there any questions on payroll?
You have kind of a question about James Lynch. Is he still working or? Yeah,
I'm sorry.
he only worked 40 hours. Is that, did he just start or?
Who did you say? Bill?
James Lentz
Yeah.
for the road department?
Right.
What's your question?
He only worked 40 hours.
Oh, he didn't have the overtime. Is that what you mean?
Okay,
Oh, I'm sorry.
that's fine. I just curious. Okay.
All right, any other question?
No.
I'm sorry. All right, was there a motion to approve payroll for June 10th?
I'll make a motion to approve the payroll of June 10th,
All right,
2026.
is there a second?
I'll second it.
Moved and seconded. Is there any more discussion? Not all in favor, say aye.
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 Aye. Carried. That's done. Next is the Kickapoo Tribe in Kansas letter of support.
We talked about this last week. Did we get any more information?
I've been going through the packet that you gave me and making notes. Obviously, the letter of support we can still do. I'm assuming what's gonna happen is they'll probably have. There, in a normal course of action, will be meetings between the contractor and the owner. And, the notes that I'm doing, we can give them if they want to use them. They don't have to use them, but they have a complaint, regarding the project being put in as pursuant to the plans and specs. We will support them in their request to have the items corrected before final payment. If they want to use the notes that I'm making, they can use them. If not, they can continue down the road and go into mediation or arbitration or however their contract spells it out. If that makes sense.
Had you heard anything else?
No, I haven't heard anything. I thought you rewrote the letter, but did a real good job.
Yeah.
Appreciate that.
Okay, so if we send this, if we decide to do this, then you have notes that you've been working on, that will all go together.
Yeah, I mean, we can send the letter before the notes. The notes would be prior to any meeting that they set up for negotiations.
Okay.
So this basically is just showing that we support their action.
All right. Well, is there any more discussion on this? And we'll want to make a motion?
And no reason. Sign and send a letter of support to the tribe in the dealings with there's no construct communications.
Okay, is there a second?
I'll second it.
Okay, it's been moved and seconded. Is there any more discussion? If not, all in favor, say aye.
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 Okay, motion carried. And there it is on official county letter. We'll sign that when we're done. Okay. We are rolling through this. Tammy, would you like to come up?
Literally just received these, do you remember, Sean from Pro Seal came in to talk to us. He just sent me the estimate that we have to provide,
Oh, yeah.
so I just thought I would bring it in now, but. I don't. That's. Not near as. I counted about 10.
That's why I just counted 10.
Okay.
Want to say it out loud?
That, that was what I tried, thought too, when I tried counting.
Okay, I have that literature someplace at home.
Yes.
I don't really remember exactly what this. Do you
It
remember
was-
what it was?
Yeah, it was a.
Was this the microsurfacing?
No,
No, this is actually, they call it a rejuvenator.
yeah,
So this is where they go in and they apply something that actually stabilizes. Supposedly stabilizes your road. Supposedly gives your road longevity. So when he was here before, when we talked to him before, one of the things we requested is, where have we done this before?
right,
What agencies have they worked for? Just something where we could talk to somebody and see where it's being applied and what they think of it.
I'll look back and make sure.
Okay, it's been a while. Oh,
Cause I could. Buried in my emails.
all right. Will you check back? And if he happened to send it, that's great. Forward it to us. And if he didn't, could you email him and ask him?
Yes. That's what-
Okay, perfect. Thank
All
you.
right.
Thank you.
Okay, all right. Is there any comments on this?
I mean, like all companies that have talked to us about alternative methods, we just have to make sure that before we proceed with anything, that we're talking to other counties and seeing how long it's actually lasting and what kind of results they're getting. I think most of our problem with our roads has to do more with the actual surface rather than the base material on A lot of the roads, we have good base material, it seems like. I know you guys have core sampled prior to me being here. It showed that on Prairie Road, so I'm not so sure that this is going to do what we need, but it still doesn't hurt to talk to them and see who's using it, because if it prolongs the road and allows us to not chip and seal on that road for a longer period of time, then you have to kind of weigh what it's costing versus what chip and seal would cost on the same stretch. So still a lot of work to be done before we decide on anything like this.
Yes. Okay, all right. Bill, you have any comment?
Nope.
Okay. We'll roll on here. Item number 4 is internal property use request for early voting. Is there any discussion on this?
Why do you have to do this thing? I mean, I understand. No, I'm,
Oh.
This- yeah, why, I mean, you're the clerk, it seems like, if, and you also handle the voting, so. Do. Okay, okay. So it's basically just procedure. But in your position, you wouldn't have to ask for a request, correct? Really? Okay. I see. Okay, well, that's what I was kind of getting at. I mean, you have, and you can come in on the Saturday if you want, and you don't have to get permission, so it's just wondering what.
This is for the.
Yeah,
Okay, well, is there a motion to, on the, internal property use request? Go ahead.
Go ahead.
I make a motion, we approve the property use request, by the clerk's office for Saturday early voting on the 25th. Are we approving the 25th of July and the 24th? Yeah. October? Okay, is there a second?
I'll second it.
Been moved and seconded. Is there any discussion? If not, all in favor, say aye. Aye.
Aye.
Okay, motion carried. All right. Okay, Austin said he'd be here. He was burning up the road from Nemo County. He'd be here about 1:30-ish, so. What else do we have in the interim here before our 1:30? I could comment on, we had at our work session, we talked about the scale at the transfer station. I'll find my text message here, I'll record it. Okay, I called and talked to Heather, and she had said that the scale indicator in the office went bad and that it's original to the scale. The scale is calibrated when it is serviced, which is about once a year. And the scale technician says the structure of the scale is in good shape, the bones of it underneath. She said there was one corner that is starting with had some corrosion, but structurally it's still very good. And that it is a good unit yet. Heather says the scale is old, but it doesn't give much trouble. So that answers some questions. So the indicator in the office went out and they replaced that, but it was 30 years old. So there you go.
So the corrosion that we're starting to see in one part of it, is that on the metal ring, do you know? Is that what she's talking about? Maybe that's starting to rust, because otherwise it's concrete and
So it's underneath.
it's underneath.
The way bars under whatever the superstructure is, it holds that. Right. If you go in the manhole cover, get down in there, to one corner, you can add some. The scale.
Sure.
So,
I wonder if there's a way we can get down there and proactively clean up that corrosion and see if we can fix it before it gets bad.
we just have to ask them a question.
Okay.
Or I can ask them a question. And find out. But she said it's very low maintenance and it gives very good service and they very rarely have trouble with it. But of course, when they do, when you can't weigh in and weigh out, that place stops. So it's important that we keep it in good repair. All right,
Very good.
that's what I was tasked with on Thursday, I believe. Somebody, I think you were working on the report we talked about for the letter of support. Did we ask you with anything?
Okay.
No? Weekend off? Do we have anything else? Still about 15 minutes?
Been visiting with a few people, had issues with the roads and more questions and some things they want done in the future, but nothing.
Okay. So, I received a call from Brandon Roberts before the meeting, and he's driving in from Lincoln. There. If we could, since we have a few minutes before our next, would we be able to call him on a speakerphone? He had a couple questions regarding the emergency declaration. Told him if we could work it in, we'd give him a call, so. Sure. You want to call him? Do that.
Mikey, but.
Hey, Brandon, we spoke a few minutes ago. You were talking about the emergency declaration and extending it. So the commissioners have about 10 minutes that we can talk about this before our next appointment. Do you want to ask the commission what you were talking about with me?
No, that'd be fine.
Okay, go ahead. You're on speakerphone and we can hear you.
So, see, when I got done talking to you, I just talked to Sarah with KDIR, Kansas Department of Emergency Management. I'm going to meet with her, talk with her tomorrow more, but there's a list that they're kind of getting together for counties, because the state is going to try to do a state disaster. So they have to hit a $2 million mark. So they want everybody to extend their disaster, just to make sure we got plenty of time to get everything in. So if we could extend ours for at least that 7 days, 8 days, I can't remember exactly what it said on there, but at least extend it till next Monday and kind of see where we're at from there. So, and I'll know more from the state tomorrow when I get to meet with her. So I just think it's a good idea just to make sure we get everything encompassed in this thing so we can get as much there, have the possibility of getting as much money as we can reimbursed. So.
Okay, so is there any downside to extending it that you know of?
No, they want you to extend it. Yeah. Yeah, no, it doesn't hurt it by extending it, nothing, no.
Okay.
The first one they put out was that 3 to 5 days, and they knew, since that really happened on a Friday, it was going to be hard to get much information in 3 to 5 days. So now they've extended it to, it was actually till this last Friday, but now they're telling us to go ahead and extend it another week. So
a 7-day extension?
From today, because that way by this coming Friday, I can have a little more info and be able to bring it to you guys next Monday and say if we need to extend it again, or kind of what the state thinks is going to happen if we're going to hit that 2 million threshold. So, because if the state hits that, then FEMA will definitely step in.
Okay.
So right now I think it's still kind of in limbo if there's going to be enough damage out there. So.
Okay.
I think just from what little bit of information I've got so far from townships and county and, road and bridge guys, I think we're easily going to hit, a couple $100,000 probably. I mean, by the time we face all the rock and everything. So,
Right.
We're going to easily hit our threshold for the county, and it's just going to depend on if the state hits it. So.
Okay.
But there is some state funding there. That's something that once FEMA decides if they're going to take this or how it's all going to work, it's still new enough to me. I've just trying to been asking questions as I meet up with other emergency managers or call them or whatever. But when I talked to the state on Friday, they said just keep doing what you're doing, and all that we need to have in is in. So which I'll talk with her again more tomorrow. So.
Okay. And when I spoke to John Sellon and Jerry Heisel last week, I requested that they give you a call and let you help them out with some of the pictures, documenting some of the damage. Have they both reached out to you?
Yeah, we talked, pretty much every day I talked to both of them all last week. So we were just making sure we weren't going around, looking at the same stuff. So
Right.
if Jerry had one, he would tell me, and, I'd make sure if he hadn't looked at it, I'd go take pictures and that kind of stuff. So I've got a bunch of pictures and a lot of them wrote down, and it's got, I think there's 4 roads still closed right now. So we've got them on our list, and I updated them in Web EOC, which just lets the state know that we technically still have road closures because of the flood. So,
Okay.
yeah.
How about the townships? Is the communication going between you and the townships going okay, or do we need any assistance on that?
I mean, I've talked to most of them. I think about the only one that I really haven't connected with was Powhatan Township. I tried to call the other day and didn't get a hold of anybody, so that's about the only one I think that I hadn't got contacted with. But in which we were down there and looked at some stuff. Jerry was down there, then I was down there Thursday, Wednesday, whatever day it was there. So they'd already fixed some of that stuff down there on like Falcon Road, some of those things. So,
Okay. So, Bill, who would be his main contact with Powhatan?
That's the first person I'd call, I think.
Bill Rieger. Do you have Bill Rieger's number, Brandon?
no, I don't. I think that's one of them that name was brought up, but I didn't.
Okay.
I need to get that from the county. But
Nikki, you said you can email him? Okay, so you're gonna get an email from Nikki with some more contact information on it.
okay.
So you were trying to contact Eric Fritz, or who were you trying to contact?
I'd have to look. I don't have that list with me right now. Who I reached out to there? Somebody had told me from. Yossi is who I talked to, and then he said reach out to, and I cannot remember his name right now, but I talked to Rex Lockwood and to Yossi, and then they told me that would be Powhatan's side. So, but yeah, I don't have my book in front of me right now. So, but yeah, if she sends me that, I can sure reach out to Rieger. So,
Okay, well, the morning of the storm, I know that we reached out to the townships and basically, it's not that they need our help. It's just, we reached out to them just to say, if you do need some help. And I was giving them your number just so they had it. And, if they were, I know they're all busy and they've got jobs. And so basically what we were saying is if they need you to go take a look at some damage for them, that we were offering that up. So.
yeah.
Okay. Okay, so you're looking for a 7-day extension from today?
Yes,
Okay.
that way I can kind of see how this week goes. Hopefully know a little bit more after tomorrow and definitely by Friday, because we have meetings on Fridays with the state kind of going over the wildfires and this flooding and the storms. So there's kind of a Friday group meeting where they'll talk about different things that go on and where they've gotten through the week.
Is that
So-
in Topeka, or do they do like a teams meeting?
It's usually just whoever reaches out for the region. So like JD's who I talk to. So I'm guessing this week they'll probably do some kind of a teams deal, just because, there's 6 counties or 7 counties in our region that all did the declaration at the same time last Monday, like we did. So there's more and more that have done it. So, and that are getting information. So I'm guessing they'll probably change that where it's more of like a teams deal where we can all kind of talk about what we got going on and who's doing what. Yeah. So I reached out to Eddie real quick the other day he said, man, I've never had a disaster of that nature, that big for flooding. So he's like, I'm not much help. I'm like, well, shucks. So I reached out to my contact down in Leavenworth County, and I've talked to him quite a few times. So he's been a lot of help. So, and I don't think Doniphan County did one. They weren't on the list. So I don't know if they didn't have as much flooding over in Doniphan County, because I didn't reach out to Scott Morris to see, but they weren't on the list of the ones that I see for our region. So,
Okay, well,
so yeah, if we can extend it at least till then, and then I can always reach out, or we can, if you guys have your meeting on Thursday, I can come in after I find some more stuff out tomorrow. Because like I say, I'll be talking to the state tomorrow. So,
sounds good.
all righty.
All right, thanks for checking in.
All right. Thanks, sir.
Thank you, Brandon.
Thank you.
Okay, okay, so we can't just extend it, we have to have a Brandon. Okay, all right, wonderful, wonderful. All right, so we'll do that when we have a break in the action here. Extend. Okay, just a few more minutes here, we should have talk to us about insurance. Well, sign, I guess.
So, while we have a few minutes here, do you want me to reach out to Mr. Glenn and talk to him about just getting some prices on some used backhoes, just so we would have them for our reference?
I say yes.
Basically, we know what specs they're looking for. We could give him some parameters, maybe even some, not just necessarily a case, but John Deere, Cat, whatever he can find with those parameters and those hours, and see what kind of prices there are out there right now.
I say yes.
Okay.
You want to make a motion? Do we need to make a motion or just by consensus? Okay. All right, check it out. It's a good idea to try and get in.
Signatures correct?
I think they'll just need me. So in good shape. These will need me.
This gal that's coming in here in a few minutes, do we know? Anybody see if she's sitting out here? Yeah, I'll still, okay. Okay, so Thursday on our upcoming workshop session, were you saying that that's more than a workshop session? Well, it's all day, but it is all day budget. Okay, because when I saw it, it said work session, so.
We will be working.
It is.
Yeah, first round. So just take all the numbers we gave him. And he lays it out and we start hammering through it.
Okay. Was Bill buying lunch that day? Did you say?
I believe that's in last week's minutes.
You want me to bring you a pack of lunch?
No, because I have a feeling if you brought the lunch, it would be a piece of bread with no mayonnaise, just like one piece of meat, no cheese. I mean, very. Am I wrong?
Well. Well, I make them might be, but.
Well, welcome, Amber. We have you at 1:30. You can come on up if you like. It's 1:29. We'll wait to start till then. Austin Parker's on his way, so he'll pop in whenever he gets here. But we've got a copy of. Yeah, what you sent us is here, and make yourself comfortable. It's 1:30, so Here we go.
For the opportunity to visit with you guys today.
Do you know everybody here?
So
Oh,
nice to meet you, Amber Fletcher.
Richard Tesserero.
Okay, yes. Nice
And
to
I'm
meet
Lucas,
you.
yeah, and I see you again.
Correct. So in front of you, the first thing that I would review like this, have that, right, give you a copy. This is just kind of a quick summary of kind of what I put together based on what I think as far as goals go, and possible solutions. So I understand that savings is the goal for you all, and just finding ways to care for employees' health insurance. Yeah, got it. But make sure that employees are taken care of with their health insurance, but also that the county isn't throwing away money that it could be saving. And so certainly there's some blanks in there too. I want to hear a little bit about what your goals are. But as far as long-term savings and having accessibility to our local network, we have already been in contact with Amberwell. I've been talking to their CFO about setting up a direct contract that would be beneficial to your employees and then also other employers in the area. That way, employees could go to Amberwell and get services at a either discounted or just a more streamlined approach. Sometimes it might be the same as what a network would provide to them as far as cost goes, but sometimes it can help the bottom line on claims also. Does that make sense? So a couple things. I know you guys have a Blue Cross Blue Shield level funded, so I was able to get the claims data that we needed for that. If you chose to use a local broker like Saylor Insurance, we could support that same plan. So if there were no changes to take place, but you did say, hey, it makes sense to use somebody local that can come in and provide education to our employees or be there for open enrollment or whatever that looks like, then we could still support that same Blue Cross Blue Shield level funded plan. But every year annually, we do look and say, okay, what are your goals and are there other options out there? Is there a different Blue Cross option? Is there an Aetna option? Is there a Cigna option? Is there a third-party administrated option that buys those networks? So one of those that we did look at is a company called Trustmark. And you should have that also quoted. That is a soft, sorry, I'm trying to find the actual.
It was on paper that you handed us.
Yes, yeah, the summary is on there. So that would be a soft quote. It does give you an idea maybe of where they've looked. The current price per year is the $538. That's their soft quote. That's before they get the updated claims data. But when I look at what they're allowing for claims, claims are made up of two different buckets. There's the claims bucket that's below your stop loss carrier, and then there's what your stop loss carrier covers. So the below the stop loss carrier, that bucket is filled with $216,000 on that specific quote. But when I pull your actual claims, it looks like it's closer to $600,000. So there's a very good likelihood that once they would receive updated claims data, that could go up even up to $400,000 or so. So while the 500 probably looks like an anomaly, you're like, yeah, no way. If I would say if you're trying to get budget together, think through it as if it were $1 million to $1.3 million. And then we would have some updates as we get more claims data. We can keep checking back in with those third-party administrators and get updates along the way. Okay, now what would their quote be? Because they do have a hard time giving hard numbers prior to 3 months ahead. And so I know that doesn't always work with budgets. So we can kind of get softer numbers until we get to that point. Health Easy is another one that I would like to quote with. They're again a third-party administrator. They can use any the Aetna, Cigna networks. We can rent them basically. And so they would be another one like Trustmark that we could get a quote from, but they declined to quote until they have more updated claims data.
These are companies like Blue Cross.
Say that one more.
These are companies like Blue Cross.
They have a lot of the same contracts with the different hospitals and providers.
So they make sure.
Right. When you look out in the industry as a whole, you're like, okay, Blue Cross, Cigna, Aetna, United Healthcare, like those are your main ones that are contracted with your main providers. I know talking with Austin, he's like, oh yeah, Cigna's fine. You know, like we looked through at providers that are that people in Nemaha County were using and couldn't find any holes. Can there be somebody that they're seeing? There could be a specialist that's not in network, perhaps. But could they see a network an in-network specialist? For sure. I think I know their utilization of in-network providers is 100%. Now that's with the Aetna network, but I don't have any holes that I'm finding in the Cigna network either. So I would expect it to be similar, but you wouldn't know until you put those into play.
So what is Trustmark, what? They work through one of those other companies or?
So they're the third-party administrator.
Okay, they're.
Yep, and then they buy or rent the network. So the claims do actually go to Trustmark or Health Easy, and then they have their claims process to process it, and then they pay it out directly. So a lot of times the claims actually process a lot quicker than even like Aetna would have everything in one, right? They're their own administrator and their own payer. But sometimes those are taking 10 days or more to pre-authorize a surgery. So a lot of times we can get things actually paid quicker through this method.
Are there any other counties using either one of those two third parties that
Actually,
you're aware of?
so I'm also in charge of Nemaha County, and Health Easy is intending to be the 2027 valve that they'll use. They're currently using an Aetna level funded plan, so similarly to your Blue Cross Blue Shield level funded. But they intend if it continues to look like they're right about that to Health Easy and the Cigna finance.
What about any other counties? And
Those are the only counties I have, but I do work with a broker in Kansas City. And so a lot of what I get is kind of through them. They're a general agency called Legacy Brokers. If I'm ever not available, I mean, they're a full agency. And they do work with a lot of counties in the area, in Missouri especially, and then throughout the US. I would say as a trend, people are going more self-insured. Your level funded is still a self-insured product. But as a trend, for sure, it's becoming more prevalent because people are seeing all the waste and opportunity for them to get money back. Hello.
Hi, for a long time.
I know, it's been a while. Most of it. Yep, this is the summary. And here is the soft code that I didn't find a minute ago.
We had it on our screen. So. Thank you.
yeah, it's not good waste.
And then when I reviewed the claims, this is actually not the claims through Blue. That is the claims that Trustmark pulled when they assessed. So using the census, they can actually pull the GRX to get an idea of what maybe some of the claims will be or have been. And so this is just kind of a quick summary. I know I've seen some of the claims numbers, but it's about 33 pages. So I thought this might be a quick summary of what claims might look like, and maybe a good idea of why I was thinking we needed to budget a little more than what this soft quote is showing. On on this sheet, it just kind of gives, and Angle's actually one of the other carriers that we quoted with, but on this sheet, they're kind of giving an idea of the top cost conditions, the top cost drugs, and then just a little bit of on the demographic on the back. So with that, I kind of went ahead on the drugs because there's quite a bit of drug spend within the claims, that just to kind of give an idea of where those lie. Because also changing to a third party administrator gives you some opportunity to switch to a different model on your medication coverage too. Because some of the medications with flu, they might say, okay, for Ozempic, for example, we allow it for both weight loss and for diabetic. But if you have a third party administrated plan, you can also say, hey, under this third party administrator, we allow it only if there is diabetic care or something like that. So there can be some adjustments made too. It's not a requirement, it just is something that we need to look at if that's a goal.
What about, do we have any return? Like we talked about 100% return on that, which do we have any?
It would depend. Angle didn't actually quote on this one. Trustmark doesn't provide a return. They're the only ones that I have a soft quote on right now. Healthy Z would, and that was the one that we quoted on. But I don't have a quote yet for Nahaka. Or I'm sorry, for Healthy Z. They want more claims before they'll provide it later.
So we're kind of in the exercise, sometimes I use the whiteboard or something like that. We've got 1.364, do we know where our renewal quote is at? Is it 1.3, let me say, is that?
That was the budget number that was on the, yeah. But for 2026, I think, not 2027 yet.
Okay, so. Let's say.
That was with the escalator that they were talking about, was about 10% escalator this year, right?
Yeah, 1.364, that would be escalated.
I think so.
Okay, so let's say we 1.3. So this quote right here. With the recommendations, it's one. Because I added the
Yeah.
balance.
Perfect.
So that gives you a total balance. 209. Additional carryover. What we're talking about is that. You ever how I did that crazy looking graph a little while back, and talked about if there were savings. That may be able to come out, so LBC, what the employee, well. Office will allow us to have 100% return. If we only use 500, like right here. You know, on the chart that you have there, that Amber provided. The trade trust.
The 538.12.
If we only use. Whatever that is. Oh, here it is, yeah. Yeah, at the bottom, if you only used. Like 450,000 to 538. No, or. I'm sorry, that 418,000 of the, or 518,000 of the 660,000. Or whatever that we're having for the overage. Okay, because we fund that gap. If you only use 500,000 now and you had LPC, you get to that back in fifth. Which means receivably we could get them. I'm not fully to this, but I use the example of maybe 3 out of 5 years for my need. We never go over that. We want to be like our cat. So from yellow right now, we're trying to bring 209,000 in yield. Just off the bat, you're trying to bring 209,000 in yield. Then you may get another million, or not another million, but another 100,000 out of that. Every year. If we're lucky, almost 300,000 would save. So if you continue to budget at your full budget escalator of 36, cool. Right? Year 5, year 6, we're at $1 million in reserves. And then you start talking about. Your funding, any type of increase in the line after with the line, you may be able to. Maybe able to go up from the $50,000 claim to 75 to reduce it, will be able to run anything to cover this series of self-insured. Then you've got the other thing, 30 years insurance. Well, line back in general divisions. Paperwork comes up, but they're probably for the area different workers' comp insurance provider. That's a $200,000 insurance. You start to reserve. You know, when this balance starts to peak up, it's not gonna happen overnight. But as you get more and more balance and you can self-insure more, smaller risks. Reduce your overall premiums, and that's one way to try to tackle some of the budget. Does it make sense that what this is doing?
You're basically hedging.
What hedging is, and by doing this, you're self-insuring, which drives down the insurance. The majority of. Other stopping from wrong, but an insurance claim. Claims box with a payer. There are very few claims that come in at the top. Majority of the claims are in the middle to the bottom of the track, right? And so when you increase your line from here to here, you're paying substantially less. It's a real simplicity.
So when Greg was here before talking to us, one of the things he noted was that we spend. Basically, if he's looking at other counties as a whole, he was saying that we spend pretty high amount on meds. And that's what was affecting us the most,
Yes.
is the way he was kind of saying. So. I mean, it is what it is. That's, our employees are using it. They have every right to use it, but that's where a lot of the expense is coming from. So how does, let's just say you went with something like Trustmark or whatever, how does it affect our employees? Like, when they go to the doctor, what are they gonna see differently than what they would have if there were no changes?
So they would have a Cigna card, just like they had a Blue Cross card. So on the walking in, nothing. On the claim side, once the doctor has billed, it probably would be faster. Hopefully, as far as between when they get their portion that they need to pay, because we've got that third party administrator, that's their job, is to administer, and they're getting those claims out faster. But on the employee side, they shouldn't see a difference.
What employees are gonna worry about is their actual health coverage.
Yeah,
The time that it takes to get
yeah,
a procedure approved or
yeah,
paid for or whatever, that's just part of,
the paperwork side, yep.
that's part of the paperwork side of it. So my question is how does it change our average employee to where they're going to see their doctor? How does that differ?
It should. The employee has a full health plan with Blue or Aetna or wherever, and they have a full health plan this way. We just have a third party administrator. We have a network, so we've got a couple pieces to the puzzle, and those pieces are not all the same pieces. Here, we've just got Blue Cross. Here, we've got the three pieces, and they are not going to see that. It's on the paperwork, the function side, that the puzzle pieces themselves fit together.
So, can I ask another question?
Yeah.
All right, Amber. I see. There's almost an obvious choice. I'm not trying to speak on behalf of the commission, but in terms of the price versus the value, the 600,000 is still and there's still a deductible for the individual, where there's no deductible on the Trustmark Healthy Choices. For the calendar year, home insurance is 50%, but it's up to $3,000. That's couplable by, I think we have an HRA. We have an HRA. That's it. Okay, so the limit of that goes up to 3,000, then we're able, basically. The idea here is that we have an employee amount that's covered. I think we're covering 587.63, and then there's some buy-up for potentially family and not, we'll have to figure that out, what that looks like for sure. But we have. In this realm, it looks like, with the exception of $3,000 that could be under an FSA, it's $0, right?
Right,
Okay, now, there are co-pays. That doesn't count against the $3,000, does it?
yes.
It does? Let me ask another question. If they do this, are we still working on options to try to work with the local hospitals? So there's a possibility that then there may be better, if you go to a local, there may not be, you may not have the same level of copay or potentially no copay, right? Okay. So basically here, you've got insurance for an employee, and there's 45 employees that this would fall under. Right now, if you don't change anything, this plan, Trustmark Healthy Choices, which is modeled in that 1.154 billion over there, that is a $0 deductible. No, I mean, it's not a $0, it's a $0 deductible for employees. So it's apple for apple. There's a potential that they'll have no copay, and they have $3,000 max out of pocket, which they can cover with a flexible savings account. And you're saving $209,000. Now, the difference is they're gonna turn in claims to a third-party administrator instead of that. But all that back end is doing is negotiating out with each insurance, each bin of service providers, whether that's Topeka, whether that's Mosaic / Mental Health, whether that's University of Kansas Healthcare System or our local options. Those are, Stormont Vale, down in Topeka, but our local options, Amberwell. They're gonna get, we're attaching to that network to get their negotiated out rate. We're tackling into that, but we're also specifically negotiating with local providers. Amber is in this model to try to get to a zero sum. So you're basically not affecting with this savings the quality of care that the employees.
Right.
And most of the time, probably most all their providers are still going to be in it, but we can do a spot check if there's a transition.
And really, like any of those pieces, those are all just the information on that. The employee doesn't, that's between the billing and everything, the hospital.
Is the 45 number correct? I thought it was 59.
45 of employee only, 45 of employee spouse, employee and child is 7, and then the full family coverage is 3. And there hasn't been, I don't know what the additional cost is that the employee, because right now it has us covering all of it.
I have it quoted at 59 too, but yeah.
So 59, but right now, without any employee buying on anything, those numbers don't have any employee contribution for families or kids or spouses. Those numbers are literally just the county covering everything.
So when I look at this in each category, I'm looking for why does the first one on the left seems at 538 seems like the best choice. It's got the lowest deductible. It's got the lowest. I mean, why is it cheaper than the one on the right, on the far right, which has a higher deductible and higher out of pocket?
Yeah.
Does that make?
Yep, that's a good question. One thing that's different is the x-rays and labs have a copay on it versus going towards deductible. So in that case, this one would be a loser. The pharmacy is a little bit higher on the lower cost plan.
Okay.
That would probably be
Part of
a
it.
bigger
That would be
part.
part of it because they're probably looking at it with us. We're using pharmacy the most.
So what does under that prescription drug benefit, it says 2065-90-00. What do those numbers mean?
So that's tier 1, $20, tier 2, $65, tier 3, $95, tier 4 is showing that 0, and then tier 5 is that 0. Now that would be 0 after your deductible. So they're showing that on tier 4 and 5, you have to reach your deductible first before it's covered.
I'm just going to keep throwing questions. What is tier 1, 2, 3, and 4?
So every medication, there's a formulary, which is your dictionary of all the medications. And then next to that name, whatever name it is, it will have a tier. So that is their rating scale on whether it's a generic, a preferred generic, the third tiers and up. Is it
that a tier
specialty?
price then?
Pretty much.
Okay.
It's not a flat, like, here's a $10, but yes, if it's normally 500 to 1,500, it's probably a tier 3.
Okay.
If it's tier 4, it's probably
That is-
2,000 and up.
So if it's tier 3, then employee has to pay $95.
Mhm.
Is that a month or is that a prescription?
That would be for a prescription.
What do they currently have to pay, you know, Nikki? So the highest they would have to pay under the current plan is 75
For a tier 3.
prescription, for prescription.
Ask another question. Okay. We have. You guys can talk, I think my next question may be. Someone.
So the way my mind works is I always want to figure out what everybody else is doing around it, because that kind of gives you an idea.
Mhm.
There's a lot more eyes if you start looking at other counties, and everybody's had to go through the same process every year.
Yeah.
So you think that Nemaha is leaning towards going with this company?
Yes,
What are they going away from?
they have a higher deductible Aetna level funded plan.
Higher deductible.
It is, 3,500 deductible, and then an out-of-pocket max of $6,350. In Sabetha, the city recently, swapped their, Blue Cross plan with a $500 deductible for, an Angle plan with Cigna at $1,750. So $1,750 is the new HSA minimum, based on most recent legislation. So a person could opt for a $1,750 deductible, $1,750 out-of-pocket max plan. And it would be HSA eligible, which would be kind of a comparable to your FSA, except HSAs are something that the employee can keep and add to themselves. FSAs you can too, but you're restricted to that year. So it kind of gives a longer term savings option. What they found though is that they provided the full deductible, the $1,750 as a upfront HSA contribution, and it's made a lot of employees want to add more people to their plan. So if you also want to be conscious of who all enrolls in the plan, it might also be wise, these aren't the only options. It might also be wise to look at a little bit of a higher deductible plan, even if you offset it with a health savings account contribution or something like that, as just a method to help those that aren't using it to maybe save up for when they do, or encourage people to just evaluate, is it a necessity? Then you've got some money in your HSA to cover it. Versus, well, it doesn't cost me anything to go to the doctor anyway. I might as well go every day for the week because statistically, people don't necessarily access healthcare more when it's less, but they do access it less when it's more expensive.
Yeah.
So I don't know how those. I don't know how.
Yes. Question.
Yeah.
I'm running some back of pencil math. If we have 59 on right. If we went with, and because most counties, they have a buy-up option. So if we had the base option, the one that's 420, and we had the larger one, right? You're at 420,000 as your base fee, and then people can buy up.
Right.
Right, so there's one option. Now, that does something that's different. Okay, so I started to run some numbers. When I'm sitting over here, and I don't even know if this other's a possibility. But we could cover, as a county, you could cover up to the 9/11/44, which is the employee plus a child. Right? Then everybody else is that wants to go to an employee plus a spouse or a full family, they pay on top of that. That doesn't change the part of the conversation that we had, because we have a lot of individuals that are eligible for Medicare. That have determined that, why wouldn't I just have private insurance?
We're adding 400,000 to this, though, that 9/11, that's not a real number, right?
No, it's a real number. So the 9/11 is how much that would mean that for everybody with the exception of employee and spouse and full family, which is 7 out of 59, everyone would have full zero deductible coverage without any buy-in.
Yeah, I want to ask my question again, because I thought this trust mark, where it says here, I would expect the finalized quote to add 400,000.
That's included in those numbers over there.
That is,
So
Yep.
these numbers.
Yeah, he added it there.
yeah,
Basically,
to get basically this plus 400 to the million. But that isn't shown here.
That isn't shown.
Well, it's not calculated in.
Right,
the-
so this employee child, that 9/11 would have to go up.
Right,
So it would,
yeah,
oh, okay,
it
that
would go up some, yeah, you're right.
But that 209,000 in savings
Uh-huh.
includes.
Right,
Okay,
Got
so
that.
then over here, so let's say that you did that other direction. Right?
you mean, is this specific deductible?
That is the way that the third party administers the plan. So that means that that claims over 40,000 would go to the stop loss carrier bucket versus the claims bucket that you all are funding with your premiums.
Right now, we're 50,000.
Okay,
Isn't that correct?
And
50,000.
this can be adjusted,
So if you adjusted that higher, then
It
that
would
should
re-
make this go up.
Right. right? Or it would make it the same and we'd be putting more money into that claims bucket. Would further reduce cost over time and potentially more savings.
So
Yeah.
what would be this number? What would? If we. Sorry, I'm gathering my thoughts. I had a conversation about the actuary, the potential provider for. When we talked a little bit about the weight loss, CGC, change people's monitoring CG. And then there's a lot of people that are thinking about GLP-1s. Not that it's necessarily any, but that may be a part of the conversation here, but I just started to run, so maybe we could touch on that, but also I was thinking here about. So if we took, because there was a conversation a couple weeks back on what would it look like if we were incentivizing people to consider whether they did this or whether they did other options for cost. Okay. If you went and say you did Trustmark Healthy Choices, the copay is 40 instead of 25, 35, 40. But we're working on local options to reduce that anyway, eventually, right? But let's say you had that Trustmark Healthy option. So I ran these numbers here, sorry. At least this. So 1,364. This is with everything just as it sets. Okay. Right here, where it's at. If you had I'll use the other two colors. So let's say that you did it there. Let's say that you kept and you just funded everything up to 9/11. Right? So you let everything spouse plus child. Employee plus child, 9/11, fully funded. And then anything that they want above that, the employee has to provide. You start with the zero deductible plan, right? You're not driving anyone that's the specific incentive down, but you are, there is an effect on. So that could be $1,000 a month. Something employee. Right? So it's really 9 people that are gonna carry this for 7 to 9. Okay, everybody else is still gonna have full without anything touching that, all right? And you leave yourself in that top plan. Your savings by doing that is an additional $68,000. $371. So that puts you at $278,389 guaranteed savings. Not yet with the soft quote, but and then if you have a return or whatever back, there could be additional funds. Let's say that you went into the Healthy Choices, right? And you offer employee buyout. Well, employees can use their FSA to do an employee buyout. They can pay that deductible. So here, it's going red. That means that the effect on an individual employee, the individual employee that gets much less. So you've got 14, so for the full family, they're at $1,493. But the buy-up would be to $1,910, so they would only be having to come out $300-400 a month. The individual employee would have some incentive because they would have to come out $457 to $587. So there's $130, but that would be covered by the FSA. You could have a flexible spending account that would cover that. Okay, and hopefully with the lower deductible, and they wouldn't necessarily have to buy up because it's only $1,000. Like the difference is $1,000 in your co-pay deductible. So your young employees are probably perfect one. Right? So down here, you then have, you are saving by going with the base plan, Trustmark Healthy Choices, the $1,000, and then offering the ability for the employees to buy up their deductible. You're saving annually. Not $278, but $327,516.08. And that's before any. So you can be in annually, if the numbers help through, you're able to have similar to whatever health needs to be. You can be at 375 or $1,000 a year. 2 years. So your goal being year 5. Probably at 1.5. At the very least, you're at 1.5.
So are you advising that we would still budget for 1.364?
Oh, yes.
You still, because you're trying to get,
Oh, yeah.
You have to.
we need a reserve.
Yeah.
Oh, yeah.
Yeah, because all it takes is just a couple of bad years with unfortunate employees have some health issues or accidents or anything like that here. So if you're not budgeting it, you're gonna be underwater.
Now, I mean, you don't budget for it, you're not building reserve. But like you want to get to, if you were talking about if you had, let's say you did this percentage, and you had $2 million in reserves. Just sitting in the types of things that we can invest in, which is basically a glorified treasury CD.
4%.
4%, we're at $89,000, and that is just really growing. And then if we have, what's happened is that here, our linebacker is 50,000. Okay, you may be able to self-insure up to 75,000, which means that your price here, your base price that you're seeing, like this 538, again, that continually depresses. So if you're self-insuring at 75 or 100, you could be down. You keep dropping the amounts down. So the more that you build it up, you're never going to be totally self-insured. That doesn't mean this. But it gets, Amber, stop me if I'm wrong, but it gets a lot less expensive when you're self-insuring at the higher amount. Because you're all in that tree, you're self-insuring all the middle, and they've only got a few claims. Right. So that's the problem.
Are we still planning on a 10% year-over-year increase in premium? Will 1.364 be 1.5?
It could be, but Amber, I'm not going to speak on your behalf. You're not, for maybe the first 2 years, first 3 years, but the idea is that you're cutting that.
Okay.
By year 3, it's like, no, got to observe your mind.
Okay.
I know you'd mentioned,
Yeah, no.
go ahead and talk now, okay.
Yeah,
Nope, you're good. I know you had mentioned just Medicare and sometimes employees that are on group health are on it because they've always been on it. not because it's necessarily financially better. That is an area that we are able to help in. Certainly we, and I think Austin was clear, like, you're not incentivizing a person to choose to get off the plan, but if a person understood how valuable it is, they might be more likely to choose to use Medicare. We do Medicare at Sailor's office all the time, and I mean, roughly $150 a month for a Medicare supplement plan, 202 a month for Medicare B. I mean, you're looking at,
Medicare B is what everybody would rather, right?
so Medicare is made up, I always say it's a table with 4 legs. It's made up of 4 parts. You've got A, your hospital, and they get it automatically at 65. That's what you've paid in all your life. So it's typically $0 unless you're there. Or one of the other scenarios where you haven't earned the credits. B is what you pay, and it can go up if your income is substantially higher than average, but most people do pay $202 a month for it. And that covers your doctors and anything that isn't considered in the hospital. So doctors or durable medical equipment, things like your sleep apnea, things like that. And then you've got your drug plan, and that has a separate deductible, but oftentimes the premium itself can be $0 to $20. The most expensive ones are $100 and some dollars a month. And then the out-of-pocket max on that is $2,000. Again, I see hundreds and hundreds, I don't know, 400 plans this year probably. And average, most people are paying $500 throughout the year for their medications. They're very full plans. And then your supplement is actually filling the gap of A and B, because A and B actually only cover 80% of all of the costs. Plus, there's a couple other things. They don't cover like the first 3 pints of blood. And there's if you're in the hospital for over 100 and some days, there's also a gap. So there are these gaps in Medicare A and B, and the supplement covers that. So as a whole health plan, you need all 4 of those. But for most people, they're paying right around $400 and some a month for that very full plan. And the deductible is $200, $200 and some a year. I think it's $227. That changes annually. So that's based on the government. So a person can have a very full plan, and that could be used anywhere. There's not like a network. It's anyone that takes
The
Medicare.
word incentivized, maybe not the right word, but
Correct.
they just kind of education,
Right.
educating that
Here are the
There's
other options.
there's an upside to go into it almost.
Right.
Financially.
Right.
But also, sorry,
No, you're fine.
but in this example here. They're gonna have a $3,500 out of pocket plus a $1,000 deductible, and they have all this. The basic one. So for them to buy up, and they get rid of their total. And they get rid of their drug costs. So you're basically giving employees with the local option. If they use the local option, you're giving them as good a coverage as you would get if you have all 4 schools of benefit. But, and it's for about the same price now. For the Medicare folks, they would save a little bit, but not dramatic. So if you give them the base Trustmark Healthy Choices, you're basically giving them, and then if they buy up on $100 a month, they're getting at the same level as Medicare. And that, stop me if I'm wrong, Amber, that doesn't, like, unless you have a quote group like this, you can't get this policy on the market. You can't. As a private person, this is better than like the gold market that they will sell you on for $2,800. Just not there.
Are these quotes, these quotes are based on our current pool of employees and dependents. How do you say that?
They are. But
It's a soft, but it's a
That's
soft because they don't have all that information back.
it's soft because they don't have most recent claims data, and they also are requiring some either additional questions to be answered by the group or by the employees.
So if we customize a plan, design something like Austin had mentioned with the buyout,
Mhm.
and try to walk through this, and if it's blurry, just fill in the gaps. So will the quote, if our census, our group of people, if it changes, will the quote reflect that?
Yes.
Okay.
So as we get closer, we'll be more confident with the census and we'll have more updated claims data to where I can provide a firm quote. But also.
But it won't go down, it'll go up, right?
My expectation is yes, because based on what claims have come through so far, assuming that same pattern,
It's to me, like when I've worked with soft quotes before, they're using
Yeah.
best case scenario.
most likely.
Employees sign up for insurance sometime in November.
Yeah,
Okay.
and we would have that. for
So,
sure.
so then will the employees make their decision? That gets fed into this. Does the quote, does it gets finalized then? Does it still change?
Well, most of the time it's finalized before you offer it. There are some companies that would say if there's a difference in enrollment than what you said, then there are some stipulations. Usually they say within a 10% change.
Okay.
So it depends on which company we go with. I'll have to gather those stipulations. Can there be any change? And then I can let you know. There's not any change coming, or there's a possibility there's still a change based on.
Okay. And then is there an economic reason or a specific reason why this company went with 40,000 versus the 50 that's
Just-
been there?
Just rule of, yeah,
That's just what.
that's just what we've used. Yeah, so we can adjust that.
50,000 here was done for a specific reason. Do you recall? No? Okay.
And I have that claims data, so now, and as we get another set of that data, we can submit it again and we can ask them, okay, what happens if we adjust it to 50?
Okay.
What happens if we adjust it to 40? What happens if we adjust it to 60? To kind of get a better idea to actually compare those side by side. And then this is not your quote, but then I can actually list out, here's what you currently have, and here's the current quote that's available, the firm numbers, and the buy-up, what that would cost employees if they want it, versus a lot of times when people do offer two plans, which is common, they'll have decided, okay, we're gonna pay that 9/11, and then the employee will buy up, or we're gonna pay 75% of the, or 50% of those dependent categories. And then we'll take that same number, $500 or $800, we'll take that same number and we'll carry that over to the buy-up plan. So if the buy-up plan is an extra couple $100, they buy up. And then we have those side by side, that employees can make that distinction.
I read the fine print, sorry. The fine print, it says if we offer multiple plans, the total monthly cost increases by 4%. Is that, would that reflect if we had a buy-up plan? 4% of full, well, one of these things is about. What's the math, Bill? 16,000, 20,000,
4% of what?
500,000.
4% of 500,000,
It'd be- it'd be-
$22,000.
Okay, all right, okay.
Which can be sometimes, they're just saying if we go to a different, pool of quotes. So like here, we've got these 1, 2, 3, and 4. There are gonna be other, usually most companies will give me up to 60 quotes. So, it may also be dependent on if we try to choose one from one category and other as well. So, we can kind of negotiate that a little
I was
bit.
gonna say, so if, there we are, but if we were going with that plan, can we strike that clause and the fine print?
Probably. Yeah,
That's really straight.
Yeah.
If they don't want to track.
yeah,
I love striking things like that.
yeah, that makes sense. We've had some pretty good success negotiating lately, so I think we probably,
All they can tell you is no,
right,
So
and then we can say no too.
that's
true.
yeah.
But the idea is that the commission's done the right thing in terms of the one. Commission's also done the right thing.
job, and, you know, I mean, I just met with them, they're over in Nemaha, and they do a great job. You're getting a lot of good information. This is a different level of feedback than what you got in other meetings. Okay, and you've got 3 different groups that are looking right now. You have a lot of options that share, that you look at and understand what that does. She's giving you one here, the 3,500, that doesn't reduce your overall cost of insurance, it actually decreases it, and it's got marginal different benefits. You've got, you've gotten advice on how to reduce your total annual set premium cost. It's showing you what a basic option would be, which I'm sure was done so that you could present the option for a buy-up, right? Then what the buy-up would look like. And it's delivering potential savings, right? These are all of the, and on top of that, there's an ongoing process to figure out how you have local options. So you put all that together, then you've got, you know, in this bin, the ability to look, and if we went with something like this could be a rebidding process on an annual basis, where you could go back, understanding these are the terms that we want to see from various providers, and then seek bids again. Once you've gone to self-insurance, it's not like you're locked in and stay with one self-insurance provider. You can always go back to fully insured, and then you have that budgetary overage. But once you've done that, you lose the advantage of whatever the overage is, it's back to the fully insured provider. So with this, I think the only other question I had right now was on the PBM side of the table. We didn't talk about this much in Nemaha, but PBMs make a lot of they've still got good rebates in them. I'm not saying that we're our own PBM. Don't say that I'm going there. Okay. But do we have any options to maybe share some of the benefits, or use some of that as an incentive to get back, like these GLP-1s or the weight loss, or some of the other health drugs that are not necessarily traditionally covered? If we could just focus on maybe one of them. I know there's a couple of there's the oral Wegovy with Novo, but then Lilly came out. I know I've heard of Lilly like 4 times today. They've got another one that's a direct, and it doesn't have all the restrictions in terms of when you can get it. If we had 1 or 2 options for employees, particularly if we're going to force them to track their level of health, now it seems frustrating if we don't, particularly if we're able to generate some savings and negotiate back our drug. We can get some of the savings or whatever they're making off of that to help us plug in and do some of this weight loss stuff people are liking. That might be fun, because then you've actually added something to an employee. Why do I bring this up? If on the outside people want to go and get prescriptions, they can, but Lilly Direct, it's 150 at the base, up to maybe 400, right, out of pocket. Now it's an FSA eligible expense, you can spend that back, but you know, if we're in negotiation, we're negotiating out what our PBM benefits package looks like, we're able to potentially use some of that leverage. And then also with our local providers, there may be an opportunity where, particularly with the zero copay, they get a 99214 complex patient interaction visit, where with the zero deductible, they get to make maybe $90, $100 if they see an employee lost consultation, and start them on it, and then the employee gets to see a local provider too. That's why I'm saying everybody, it's a way that we keep it into a cyclical. It's a benefit that we can add. It's something that we can cover, and I'm not sure not all the employees want to use it, but it's something that normally they would have to spend more than what they're having to spend on the buy-up frame to get to.
And the PBM is negotiable, and depending on the third-party administrator, they have different ways that they use that credit that RX pass through. Trustmark keeps it. No, Trustmark passes it through. Some of them do, and some of them don't. Health Easy passes it through. So you actually get that back as a bottom line return at the end of the year.
So many reasons
So
why I like
you-
public deed.
That's why they're on this sheet and I'm
Yeah.
hoping to get some traction there too. And I was actually able to do that last week, but, so yeah, it's kind of narrowing down the quotes and then from within that, which third parties will give us the best incentives, which ones can we knock out things we don't like.
So we've got about 5 minutes before
Yeah.
2:30 coming in. So what's? Do you understand? I mean, we had a great conversation here. We went a lot of different directions, but how do we? I mean, if we were to condense this into some action steps, I mean, I would circle the one at that 40,000. I'd like to see what that looks like at 50,
Okay,
if that's possible.
Yeah.
You said something about a base with a buy-up. I mean, we explore that. What else am I missing? What you guys talked about a lot of stuff.
Obviously striking that clause above 4%.
Striking the 4, okay.
And then if you had the PBM, what that negotiation is like, what our local providers do to offset some of the deductibles.
Okay.
Right, I think if you tackle those, understanding that we're probably safely budgeting at the 1.364. And then this year, later on, before November, you have the opportunity not budget prices to make a decision. But now you've got at least one point of feedback that's complete. Hopefully we get other points of feedback that's complete that says, hey, you have other options other than the 1.364 renewal. You can deal with the market in that way, and then you can make a decision.
You said PBM. They talked about prescription rebates in the last. Does that still exist in this plan?
That's what this.
so PBM is your pharmacy benefit
That's
manager.
really.
And they're the ones that negotiate those contracts with the pharmacies and those pharmacy rebates then come back.
Okay.
And are within the plan. Or it could be the third party charges that as part of their administration fee. Depending, but that's where we can kind of start looking through and comparing. We've got these 3 quotes. This one doesn't give us the PBM rebates. This one does. This one gives us 100% of the overage that isn't spent. This one gives us 75. Some of them are 50%. So that's where we can kind of choose which third party is offering the best deal versus the total premium too.
Okay, so do you have a pretty good idea of the direction?
Yep, I've got some notes here. Do you need to see me again before budget, after budget, or as we get more data?
Because we get more data, if you're at 1 point, we're at 1.364. We think we're gonna go above that, or we could understand what the savings are gonna look like. We're trying to get to a 5-year run rate is what the budget looks like. So if we understand a little bit more of that, that's probably helpful.
Mr. Pollock
But
has
you don't
one
have to
question before we get to.
So you're talking about the employee buy-up or whatever, what does that mean?
That just means that when we've negotiated the carrier, then the third party administrator, that they've offered a couple of different plans and we can talk through what those look like.
So that means that they pay more and they get more benefits?
Right. The idea would be, okay, and this isn't
So
exact to
the
your
employee would
situation.
Pay that amount,
Mhm.
not the county.
Right. So you would pay the same amount whether they have the base or the buy-up. And then they would say, well, I prefer to have a $2,000 deductible instead of a $3,000, for example. And then they say, well, it's worth it to me to spend an extra $150 a month out of my paycheck. And then payroll would withhold that. Yeah,
What they're getting, what the employee's getting is they're getting the opportunity to get a better deal because they're part of the county than if they run the rank, basically. It's a betterment for them, or it's offered to them. They don't have to do it.
Does the access fee count against the deductible?
yes. Out of pocket maximum.
Yeah, I'm talking back to that. Okay, all right. That's, guys, this is an outstanding insurance offering. Particularly if you're based in your buy-up with anything like this, I mean, Amber, I'm not trying to speak on your behalf. This is for where most people have margins.
Including having the 400,000 expected, but still.
Yeah, this is
Mhm.
great. You're at, but I'm saying right now to save almost $210,000 without anything back. Even at the full, it's good, but when you put in, if you're at that with the buy-up. You're saving $327,000 and the employees have $1,000 deductible with a $3,500 out-of-pocket maximum. And co-pays that are livable, from an FSA that can go ahead and cover it, that's great.
Okay. All right, it's 2:30. Perfect timing. Thank
If other questions come up, hopefully you have my contact information.
I do. You?
Yeah, we have emails from you.
Okay,
I should say that the max is 7,000, and 3,500 for the employee, 7,000.
Times individual. Okay.
Right, and individual, so if you have, and that's still, you could cover that with an FSA. Like you could cover.
Your deductible.
Okay.
Which is.
Okay, perfect.
All right.
Thank you very much.
thank you.
Have a good rest of your day.
Everybody.
Nice to
You
meet you.
too. Nice to meet you. Check.
Hi, Mr. Markham. How are you? Good. Did you have a good conference last week?
Pardon?
I heard you were at a conference last week.
Yes, sir.
Did you learn a lot?
I learned a lot, talked about a lot.
Okay,
It's a good conference.
good. I'm glad. Okay, well, thanks for coming in. I sent you an email. We had a little question about some USA Trust stuff.
Yes,
So
yes.
have at it.
As far as the anything that's in USA and Trust, I ran a query on our system that has all of these parcels that are listed that way, and you can see the property type here, which is exempt on all of them, which is how we would handle all of those.
Okay,
My understanding was there was a question about what is exempt versus what is not exempt.
and the inspection and the need for inspection.
Okay, the ones that we have that are in my understanding. I had talked with a gentleman at the state a while back about this very issue. As far as things on the reservation, if it's USA and Trust, that's going to be exempt regardless of where it is in the county, whether it's on reservation, off reservation, whatever.
Mhm.
If it's within reservation boundaries, my understanding is anything that is in the tribe's name is also exempt.
Anything that is owned by an Indian tribe, or actually, I don't know what we call it, Indian tribes, they still call them Bureau of Indian Affairs.
Right.
Some places call them indigenous tribes, some places call them Native American tribes, so I go by the Bureau of Indian Affairs, so. Anything that's owned by the Native American tribe, is exempt.
And that was my understanding as well. So these were ones, now, in addition to this, just to be thorough. I went out and I looked at anything that had parcel ownerships that was like USA and not exempt. Basically, there's none that fall into this category. As you can see, the ones that are here. Where you see USA in the middle of a name is what's popping up
Oh.
there.
I see.
So, I want to be as thorough as I could.
All right.
So that's kind of where that came from. As far as the things that we have looked at, in the past, probably, I'm gonna say 6 months. I did come across 7 properties that were listed as Iowa Tribe of Kansas and Nebraska and Missouri, obviously, that were still listed as taxable. I've since moved them to exempt. And was planning on, with your authority, going back current year +2 as far as getting rid of the taxes on it, which is all I have the authority to do. So that would be where I was standing on those. The other thing that we have also done in the past year to make it easier for people to know where properties are is we have created layers in our GIS system for each of the 3 tribes.
Okay.
So we can go out and we can look at a parcel and see, does it fall in the boundaries or does it fall outside of the boundaries? Just for sake of anything outside USA and Trust. So that's one of the other ones that we have done. As far as this sheet goes too, just to be proactive, we were looking at several
that were listed as housing authority, which is generally not exempt unless it has a BOTA order. There were, I believe, 7 or 8, I think 8 properties that I could not readily identify as having an exemption order. So I have 4 different files in my office that are each about that thick. There's 3 for each tribe, and there's another one that just says tribe in general. I don't know what the filing system back was that created that, but it was in that drawer. I was able to actually go through and find the actual BOTA orders deep in that file.
Okay.
So I basically made copies of each of those BOTA orders and put it on our system. And so we have those. It's also listed electronically in the system as well. I don't know that that was actually the way that things were done in the past, but to me, it's better to be thorough.
What the BOTA orders do.
The BOTA order basically tells us what we have to do with a property. Whether it's an exemption or whether it's a partial exemption. There could be other different things that they do, but normally we deal with just exemptions
Okay.
or anything to do with an equalization appeal would come in a BOTA order as well.
Okay.
So they basically tell us whether or not what we're doing is correct, according to what they see.
Okay.
So that was basically what I had as far as that goes. These were the parcels, if you were interested in, these were the parcels that we moved to exempt that weren't
Okay.
listed as exemptions.
I would
Okay.
ask you, have you seen this email that?
Yes,
that
yes.
You got? Okay,
Mhm.
okay,
Mhm.
good.
Yeah, as far as the reinspection goes, I mean, we by statute are required to be on a property once every 6 years. We look at them for value for different reasons. I mean, the first would be for taxation. For exempt properties, not so much. We also, we do get phone calls from insurance companies from time to time looking for replacement costs because of a disaster of some sort, whether it's a fire, flood, whatever. And it's good for us to have the actual value on it rather than, some arbitrary figure that we have no way of backing up. So those are some of the reasons why we would be on a property.
So even if it's exempt, you have the right to be on the property,
Yes, to my knowledge.
to your knowledge. Can you
Uh,
find that like a
There
state
is,
statute or something?
there's not something in statute that says that specifically.
Because that, to me, that'd be kind of controversial. If I was on an exempt property and I saw you come on it, I would be wanting to know why you're on the property.
Right.
And obviously, that's the reason this whole question started.
Right. And I mean, what we do is we report all of our values to the state, so they have the opportunity to know how much property we have in residential and farm home sites and vacant and exempt. As far as that being codified, it's not so much that it's written specifically in there, but it is by statute that says we have to go and visit a property. That's in statute. There is an AG opinion that I will have to look up and see when that was done. But it was done years ago that basically says that we being on a property does not constitute a trespass, that we are supposed to be doing our job by doing that.
I understand on a normal property, but on an exempt property.
Well, but we have other exempt properties that fall under that same category. Just because a property is an exempt property doesn't necessarily exclude us from wanting to try to have a good value.
Is that your AG opinion?
I would have to look and see if that was the latest one. I know that I have some paperwork up in my office that
Okay.
I have disseminated to my people.
Okay,
Um,
I got this.
just so that, because we do have other people that will tell us, well, you have no right to be on my property, it's trespassing.
Sure.
And really, it's not, because the law gives us the opportunity to be there to basically treat your property like we would treat everybody else.
So in order to protect our employees, our county employees.
Mhm.
We possibly go onto a property and somebody could be hostile, not want them there.
Mhm.
Do they have anything printed out that they can give that property owner and say, look, we're not here to argue with you, this is why we're here.
Right.
Do we do that? Or I mean, what
I mean,
happens?
I
when
mean,
somebody is-
we can do that. We have, like I said, that AG opinion that we can show somebody that says, look, we're really not trespassing. Here's why we're here. And we're here, to make sure that our data is correct. To do that. My instructions to my people is if you feel that you are unsafe going on a property, leave. Plain and simple. We will value the property from the road.
I understand that. No, I'm trying to look out to try to, in the future, try to mitigate the number of times that your employees would have to feel unsafe. For lack of better terms,
Right,
right?
right. No, I get it.
Because sometimes you can de-escalate the problem if you have some paperwork and say, look, we don't want to argue with you.
Yes.
We're doing a job that the states have
Right.
basically mandating we do, and this is.
Right.
And that is why I provided them with that AG opinion to carry in the vehicles with them. So that if they do have that.
So you're looking for a short form?
Yeah, I'm just trying to figure out obviously the whole reason this came about is somebody was not happy that we were the county was on their property.
Right.
Well, and we throw into the mix the sovereign nation status of
Right.
another reservation up there, and
Sure.
and they're looking for clarity. And she asked me, and my honest answer was, I don't know.
I mean,
And so we're going
the
to.
thing with the reservation is we are going to be there anyway because there are properties there that are taxable.
Sure.
100%.
Certainly.
So we do have to value those properties as well.
Okay.
My explanation for, the other ones is even though we're there and we're looking to put a value on it, does not mean we're taxing it in no way, shape or form. We're just looking to make sure that our values are correct for our reporting to the state. If FEMA had to come in for some reason, one of the other things too that we ask homeowners a lot is, do you have a storm shelter? Because we try to pick those up and pinpoint where they are on the property, because if there is a natural disaster, we want to know where to look for people, because our emergency manager is going to be, I would assume, asking us for, something like that if it exists, and we do try to make it exist in our system.
Sure.
So, there are many reasons why we would be out there and be asking questions.
So my intention with this was I just answered the phone, and it was from a
Mhm.
lady at the tribe who had serious questions about what was happening.
Mhm.
And in an effort, the commission and the tribe are making an effort to try to communicate
Oh,
with
sure.
each other and really open up dialogue and have better relationships than they've had in the past. So
Right,
Part of
and
what-
I understand that, that's part of what I'm trying to do, with my office, is to make sure
Sure.
that, they know we're not there to change your status and to try to tax you or anything like that.
certainly,
Mine is that and there was the other thing that I'd asked Marty and said, did she give you, properties that we're charging on that we shouldn't be? Because I want to make sure that we're correct. I mean, if it's slipped through the cracks somehow, we need to make sure what's going on. I don't, it's the same with every other parcel in the county. I don't want us charging stuff that's
Sure.
not supposed to be.
so part of what we're trying to do here is to facilitate a better relationship between us
Certainly.
and the people outside of this bid.
Mhm.
So there is some gray area here where I'm not an attorney. I don't understand a lot of I don't, the intricacies of the tribal relationships to the county.
Right.
There's some federal protections there that we need to understand better. So we're gonna be talking amongst each other.
And I think it might be helpful if you send me over what we're using for access. Okay, the state statute and the attorney general opinion. I'll take a look at it and then I'll take a look at what it means in the context of private entities, because we have for properties that are in the tribal reservation, when we're valuing those are still properties that obviously are valued. Okay, but what's interesting about the level of it's just a different level of independence that a Native American tribe or indigenous tribe tribal community has in comparison to ours when it's tribal owned. And so I'd like to take a look at it to understand what we're using, and then I'll compare it against some of the federal law and see what we. Okay. So if you'd send it over to me, that'd be great.
We'll do it.
Thank you.
Yes, right. Any more questions for Mr. Markham?
Is there any? Well, you don't notify the people before they come, do you?
I mean, we've done a press release in both papers. We have sent it to our sheriff's office. You know, I would say that going any further than that is going to really gum up the works as far as us being able to do our job properly and on time. You know, we have a lot of people say, well, you should call first. I really cannot be out there trying to track down, 1,400 property owners and phone numbers and, making appointments. No. Especially considering we're just doing it outside, anyway. It's not that we're asking for access to internals. This is what we do. We have to do it this way. Otherwise we'd never get our job done. Let's put it that way.
So an on-site inspection, if the garage door's open, you just walk past the open garage door?
You just walk past it. I tell my employees, you do not go inside.
Okay.
Unless you're invited, and even then I would decline because,
Okay.
it's not something we're doing on every property.
That's a common question, and I just wanted to have you answer it
Yeah,
on.
yeah. No, I mean, we can observe because it's open,
Right.
but I would not say that we would ever go inside that.
The law of the state of Kansas, what I understand. Pretty much everywhere else. If you go inside a property beyond the threshold, even if the door is open, that's a search without.
Okay,
It's an administrative search, and
Yeah.
in the administrative search, there's a case called Camera from 1960 that emanates out of Ninth Circuit. San Francisco, where to do even administrative searches of public health and welfare, you have to have some different level of differentiation that you're doing it for a reason like this. And this is beyond what's observable at the exit, so I don't think it's appropriate to go inside with that application. Then if you guys have to do it inside appraisal, then you schedule that
Right.
property.
We definitely would do that, yes.
Sometimes there is reasons why they have to do it inside appraisal, which would be.
And we have had that where it's a necessity. I mean, generally speaking, during an appeal, if somebody's major complaint is, well, the inside is trashed. Okay, we would want to schedule that, so we
Sure.
can take a look and see to what level is it trashed to make sure we get the right proper value on it.
that makes perfect sense, so,
But yeah, without an invitation, I tell them we don't go inside.
okay, all right, well, wonderful, I appreciate you coming down here, making time for us, we.
Certainly,
Yeah.
certainly.
Right
If you have any questions, you're always free
Thanks
to
for
come
putting
see
that,
me.
yeah, no, thank you very much.
All right, thank you guys.
All right, next on our agenda here, we're a little late, sorry, Jerry, it's an executive session, how many minutes do you need? 20 minutes, with executive session, discuss non-elected personnel pay and performance with Road and Bridge Supervisor, Mr. Heisel, with the three commissioners, the clerk, and the county council. So that's my motion, is there a second?
I'll second it.
It's been moved and seconded, all in favor, say aye.
Aye.
Aye. Okay, motion carried, 20 minutes is 3:08 Sorry, we're out of executive session, back into regular with no binding action taken. However, we are still talking about roads. So, we had talked about, like, for instance, across the highway, north of the Catholic cemetery there, well, just south of your house. Okay, there's the approach off the highway. This is in my head, is pretty rough. It's got a lot of chuck holes and stuff.
Makes it easy.
What if we talked to somebody and even got bids on and had that crew come in and did it?
Plus the states.
Well, is it the state the whole way?
Young Zero or Star Oil.
Okay, never mind. Never mind. I'm sorry. I thought the county was down there a little closer. Okay.
Sometimes they cheat a little, drag a little down there.
Well, we were looking for ways where we could contract with some folks that lay asphalt kind of for a living. And then have your crew kind of work with them and learn some of the tricks they have. Do you know of any spots, Well, we talked about, on the landfill road, there's the bridge, east of the landfill down in the bottom there that's got the. Built like a mill and overlay, and he knows the language better than me, but we were looking to try and partner with somebody, an asphalt company that, again, that does it for a living, and have you guys just kind of help and learn and then see if we can take some of that on ourselves in the future.
Well, that will be some costs and which you run into hospitals.
Well, of course.
One of course. Yeah, that's how part be nice. That's hard work on something else right now. I'm just. Feel like it's a whole thing is out.
No, I understand. We didn't plan on the big raise.
Be awesome.
Right, your whole, that summer maintenance just changed. Yeah, okay. All right. Well, do you have anything else for us while you're here?
So, I got a question for you. So I was talking at Lake Boulder or something that I called you about.
Yeah.
So I just tell Tammy, he wanted a 40-foot tube put in one of his driveway, just have her put it on a list. It's not something that has to be done right away or.
No.
Just, so,
Well, there by Harmon Bailey's or where?
yeah,
Across the road.
well, we wanted a tube going.
Good conversations.
Yep.
So
On a Sycamore Spring, some north of Sycamore Springs.
You guys
field
got that too.
Only a 16-foot tube or something there. We wanted to-
60.
So I don't think it's important, but I think we,
Call.
if you have a list that we don't forget about it.
There's no problem.
Or,
Right.
I don't expect you to keep track of it.
Listen, longer so they're shorter right now. Yeah.
Jerry, did anybody call you, where you put that tube that was put in Fairview, that Luke did for us, about a year ago, south of that, has anybody called you talking about a problem with? Okay.
I never got that tube hold up, all right?
I'm sorry?
That tube hold up, all right?
Yeah, it's.
I didn't go looking at.
Just trying to find the text. I told him I would get in touch with you. Can you drive that road where that tube was put in and see if there's a problem to the south of it?
Out of there.
Yeah. They were describing it on a text message, and I said that best thing we could do is just drive out there and see if we see.
What did they say what the problem was?
They just said after the flood that it's been eroded and it needs some attention, and it sounded like what they were saying was you guys had done some other work across that road, not where the tube is, but was there another location south of there?
Well,
Moss Culvert. This was all the.
Remember they cleaned out a ditch with a rented excavator?
I don't have anything particularly there.
Okay. All right. We hit you with a lot of stuff. Are you clear on what we all talked about? Okay. Let us know what you need. All right. All right.
Thank you.
See ya.
Thank you.
Thanks, Jerry.
Okay, we didn't do any county councilor updates. If you want to make some,
Yeah, well, my number one goal for this was to understand back insurance options. We haven't heard from Airport yet, but I know they're working on it.
Okay.
We've heard from our primary insurance firm, and we learned from Sailor once. So that, so I think we've got some options. So I bumped in on the way out. I told them I can't talk about business or law because they're represented by counsel, tribal chief. But the police said, hey, hey, I understand we owe you some stuff. And I said, hey, it's with your legal counsel, I can't talk to you about it. But I told them I can do for them, otherwise I'm gonna break it. So thank God. We're waiting on Kickapoo. We haven't heard back from them yet. These insurance numbers are encouraging. You know, they're not hard numbers, but at least there's an option that doesn't result in automatic annual increase every year, potentially soon. We're on track. Nikki, thank you for helping get the notices over to the papers. And we've got at least confirmation on 2 of them that it was published in the right time, so we're good for the July 1st sale. Hope got that done. Ready to rock and roll on that.
Once we have that date, we need to basically confirm that date, because they're gonna move those cars out and get them into the parking lot across the street.
We should do that because we have a hard date, July 1st, 1 o'clock.
Okay. So if I tell the sheriff that July 1st at 1 p.m.
Perfect.
Okay.
We're selling.
Now, this was in the paper, right? All those
Yeah.
cars.
Yep, July 1st, 1 p.m. We're selling. It says that it's a department level. Yeah, you know, a department can sell, but it doesn't say where the money goes. I think it's gonna go back to the general fund. Right? I think when we're selling surplus equipment, it's gonna go back to the general fund and it's up to the commission. But it doesn't say, hey, that we're conducting the sale. It's not like it's an independent department. So we're conducting the sale, we've authorized the publication, the money will come to us, and then we'll determine what we want to do with it. I think that we'll charge against the commissioners back against that. That's a good question, Nikki. I think we'll end up with an option to allocate it where we might want to spend it. Obviously, there are cars that have been collected by law enforcement, so there's that. So the sheriff we're gonna have some conversation there. We're in budget. I think right now. Update on the bridge stuff. I went back and I talked to Europe on the bridge option. They came back with a lower proposal and amount. I said, I don't think we're not counting on spending money on that. So they said, well, will you help us on the next part of the delay to try to assemble some of this, to get engineering confirmation? Will you kind of work as a U.S. liaison representative to help us try to get that? Since we're not gonna be on site for the first part of this. And I said, yeah, I'll help. I think the solution seems like it could be potentially good if an engineer says yes. So it's interesting. So I'm gonna work on a little bit of that over the next few weeks. Try to, the first part of this, get confirmation that the solution will work. And then, if we have that confirmation, we want to do it, then it seems like the right time for them to come over and have a design visit. So I'm working on that. We had a couple of odds and ends. I think I was able to take a look quickly at Open Records Act. He sent it over, it looked good. Right now I think, I'm always thinking a little bit looking ahead next 2 or 3 months, 3 or 4 months where we're at. By October 1, we're going into budget. You've got 5-year budget consultant. You haven't been a part of these meetings, so you know where your budget's at. The first thing was trying to understand that, and then what would insurance options be, and just recapping that for a minute. We started off with a fully funded option. We weren't going to look at it. Now, at least on the table, there's somewhere between a $200,000 to $300,000 net potential reserve savings that comes out of insurance, which is in government. It may seem slow. No, you kind of know. That's a big deal. In government, is a big deal. So that's a win you're looking at. We're waiting on some of the dispatch stuff. It's going slow as molasses for whatever reason. I don't know why. That's not on our end, but it's just not moving fast. It should, but it's not.
You're talking about the police dispatch,
Yeah, please.
so just. I saw one of the commissioners the other day, I was working over on this building, he stopped by after their meeting. And he said, well, they found $100,000 so far to go towards that, and I just said, it's not enough.
Yeah.
And he said, well, you know, it's a start, and I just said, Ryan, it's not enough, we're already giving you a good deal, that does. So go back and
Figure it out.
let's move forward, but we're gonna have to push them, meaning, we're gonna have to. Be some sort of an exodus, whatever.
Well, and I think that it's fine. We don't have any responsibility with fire there. There could be arguably some responsibility. We just don't have any responsibility in dispatching. Yeah, we have no responsibility. So. That's what it is. So if we want to provide a cutoff date that said we're not doing this without an agreement. That's a valid position. And quite frankly, you've got cost of it, you know what it costs. They're our heaviest user by far. It's a reasonable thing to provide a cutoff date, right? And so that, you know, if you're looking at your, and it's not like you're, I don't want to portray even the thought that, hey, you're looking at this, that you're grabbing money into your budget. No, you're just gonna have the costs. I don't think you're not. You can't, your budget is too tight to subsidize any county's budget. Your budget is extremely tight and you have no resources. So. Now, that's another question. I'm sure Scott's gonna have an opinion. I'm not trying to supplement our budget, our external budgeter, but. You gotta find reserves money. You gotta find it to us. Like without reserves, you know, we you have to. Right. And so I think you want to find that sooner than later. So in this budget process, understanding what a reserve allocation is gonna be is important. The other thing is the time is now. This summer to experiment with what an alternative road coverage situation would look like. And you know, micro surfacing, I understand some of the counties up north have liked it, Nemaha had everybody, including man says, and that's just not right. Up 62, it's not right. If you drive it, you'll drive down and you'll say, what do we do? About a 7-year story on this for more money? It's not right. So.
It wasn't right as in it was the wrong product or it was applied in
I think they tried. They've come in, they've done 2 lifts on it. I think they've done the best thing. I don't think there's a better, you know, apparently the product works elsewhere.
One of the things that gave me a little bit of cause to really want to check it out is they did it on Oregon Street out here for the city a couple of years ago.
Yeah.
And when it went down, it looked really nice. In fact, I remember driving home going, oh, this is nice. But if you drive out and look at it now, it looks like it's never been done. I mean, every crack is there. There's nothing when you look at that and go, this has been preserved in some way in the last couple of years. So that made me nervous. And when they were here, I didn't want to point that out because I didn't want to put them on the spot, but I think, you know, we agreed we thought we wanted to try a mile of it. Well, they tried it for us.
Thank God.
And so far, there's no reason for us to spend $62,000 for a mile when it didn't work.
And they had 5 miles. We have before 3 miles. 3 miles will direct us up the state highway. You drive 60. See.
when you hear Tammy brought this in, we got a bid like that. You just having it.
Oh, thank you.
That company came in early part of the year. Came up with the bid for 240 of east to town, that's for 10 miles.
You know. Not bad. I mean, what you're trying to do with asphalt, I'm not full technical. I'm not trying to split gospel truth, but basically the asphalt or the concrete is a cap that moisture from getting down. You put in 3-inch, 2-inch, 4-inch. 3-inch is supposedly your minimum. You can probably get away with 2-inch on low for moderate traffic roads. But what are you doing with the asphalt? The asphalt is designed to provide some type of a cap to prevent penetration Because what facilitates caps, there's two reasons why you have cracks. You either have. You're either your subbase, there's moisture in it. And it's not, and so things are penetrating.
Mhm.
Or things are dried out. And if things are dried out on the top, then you're always gonna have, yeah, it's gonna start to open up. The problem is that. They're trying to come up with ways to cost effectively. Redo the top layer. There's two inch mill overlay. They had this Nova chip product years ago where they started to put down a winch top. People have been trying to do this, but 25 or 30 years. The only way to skin a cat is to go ahead and moisturize the top of it and get penetration into that top layer. At a point that provides some level of stability. Right? Now, I don't know in the end what you're gonna do because your finished product is never gonna be better than today. Unless you go in and clean up your base. Right? And the strength that you have right now is that you've got chip and seal. So you've got solidified on top of the base. You've got some product that's come down that's solidified at the top of that base at some level. That was a great no, but you put moisture on it or some fashion, so there's some level of stabilization on this chip and seal road. So the question is, how do you take your point of strength? And how do you take your point of weaknesses? Is that perhaps washable? Depends on where the water's gone, right? You gotta fix that. And then you gotta have some product over the top that's stable, that's like a moisture cap. It doesn't really matter what that is. If it's an oil-based product or concrete-based, sand-based product. You gotta have something over the top that hardens the top 3 inches in a way that comes in from the whole plate. Right? The ways that I've understood from people that are seeing it is they're either putting some type of a material that will seep in, whether it's an asphalt material or whether it is a material that seeps down in and turns it into like a really almost like a concrete level hardness.
Mhm.
And then over the top, you're putting some type of surface. So the reason I'm using this as a long story short. I don't know if I believe anybody that's coming in and saying that I can put an 1/8 of an inch over the top without a roller that's not doing any subface. I don't know how that's gonna improve it.
Especially then make it level.
Yeah,
Help level.
'Cause we have a lot of different problems. We have profiling problems, we have rutting problems, we have base problems, we have. And what we keep doing is we just keep putting chip and seal over those problems, which gives us a nice appearance for a while, but it doesn't last.
Are we going to find though that economically is the Band-Aid chip seal approach? Where it's certainly not the best solution, but is that gonna be, all we have?
I don't believe so. I think that it can be, I'm not trying to speak on behalf of.
Well, no, the problem I see too is we keep building up with chip and seal. You drive through the city and you see, look where your gutters are. Your gutters are way down here and they chip and sealed so much that the profile is so extreme now that the gutters don't even really work right. So to just continually chip and seal, at some point, we're kicking the can down the road for other commissioners that are gonna have to deal with it. That's,
And the reason for saying that, Richard, is that, I mean, is that the option? Is that the option? We just gotta kick it.
I don't think so.
well, I think also, and it's one thing I don't know how the county's done it in the past. But we gotta start actively pursuing if there are any grants out there for our haul roads. Like, can we, at some point,
Yeah,
get some money to go in, because realistically, if we could do a grind. And we could, in the, like Prairie Road, they paid to have the core sampling done. The
Yeah.
core sampling showed that the base was good,
right.
right? So on a road like that, your base is good. You don't have to go in and scarify the base and redo it. If the money was there through a grant, through working with the tribe, through whatever, that could become an asphalt road, not a chip and seal road. That's gonna get you years down the road, but it also changes, because that road has so many problems now. So I think that we just need to, there's not one approach that's gonna work for us because we don't have the money. If we had the money, we know exactly what we'd do.
But I think in the end, I think what you're gonna. This is. I think what's gonna happen is that you're gonna have triage of roads.
We've already got asphalt roads that you're on some type of a maintenance schedule on. I think in the middle of the asphalt roads, you're gonna have fall route. And there's gonna be certain of these chip and seal roads that you say, hey, we need to have, maybe the gold standards. And I'm sure a lot of people that are in this industry would just throw a whole bunch of crap at me when I use the word 2. But if you've got a 2-inch and you're self-pouring and you've got bases that you've built up 60 years that are in the same spot. You're not gonna be able to go in and afford to ever rip these things up, okay? But for moderate beach roads. Hell, in 1985, my dad bought a patchment, much for the city of Park City, right? He bought a patchman and asked the road crew to go out and start laying asphalt. Now, it was a trailer and they only had a few miles to do, but in the end, they saw the form go down. Now, is that ideal? Absolutely. No. But is there an in-between?
So we're looking for.
We're looking for an in-between, but I think what we're also trying to do is, we're trying not to just bury head in the sand and just make future commissioners have to deal with. At least if they look back, they say, we did what we could do with the money we had.
Yeah,
To,
right.
to do, instead of just look at it and go, just chip and seal.
So I thought that microservice was the answer. When I find out it isn't, the urge is to just bury land.
There's more than one type of micros. I just think we need to keep pursuing. You know, this is a different product than, than that, than the
Right.
one we were looking at, so.
That's the presentation.
I wouldn't give up. I would not give up. I'm just saying that I think that. We talked about ways to solve. Large scale budget issues that we're trying to work through. And this is the next large scale
Yeah.
budget issue. So if you're gonna figure out a way to, and if you come up with. I did a bunch of modeling several months ago, where we talked about, what if we did a project that we funded, what if we did? But if you triaged it, if you understood, hey, we've got 5 to 10 miles of roads that are in need of transportation fund development.
Okay.
For next to our haul route, right? Then you're talking about a community development block grant, or you're talking about some other funding out of the US or Kansas Department of Transportation. Say, look, we need to put things on a schedule, we need to get these done. Then maybe you got 50, 60 miles. What I'm saying is that I think you're gonna find, and if I listen to the concrete guys that are around, there is a way to treat top end of the asphalt, or the top end of the base that is the road, right? With some moisture over about a 5 to 7 year period where it's gonna turn in something that doesn't have a true cap over it, but really solid. And on your low to medium roads, you're gonna be all right there. And then the rest of them, you gotta decide, at what level are we gonna spend? Are we gonna go on ahead and not slurry, but do a couple of larger projects to the roads that really need it? Put this other moisturizing base down, whatever that turns out to be, and I think we're gonna have to test what that is locally in spots.
So just for fun, is there a way? A lot of these roads are in farm country.
Yeah.
And as we get this divergence in tax, like, ag tax is going down, residential is going up. Well,
Yeah.
ags, I mean, we're hauling, we're using the roads. Can you? And don't shoot the messenger, but can you do like a special assessment that's ag land to try and make up for?
Yes.
The tax shortfall?
Yes, you can. It's an authorized under state statute to do that. Quite frankly, roads is one of those
Saying
things.
we are, I just didn't
No,
want to.
you can. But I think also it could be, you can do a special assessment that way.
We've had some people approach us. I mean, I think you said something, guys are willing to throw in a little to try and get some things done.
Yeah.
That's different voluntarily than an assessment, but that was a question. I didn't know.
No, but you're right. But in the end, I think what we want to do, I have a thought along. I think I should go out and really put effort behind talking to maybe Jeff Ham or something like that. I'm bringing up Jeff Ham for a couple of reasons. He's the president of this group out of, it's a nonprofit. Because they had hand construction, they sold it, right? Then now he's sold the landfill, but he's the president of this group. And their entire mission is to help train people to get into the trades, specifically construction heavy equipment contract, right? I think we talked with him and said, look, we've got solutions that we need to put up here in the town. Let's see whether we can't work together to come up with a couple of test patches late this summer, early fall.
let's come back, and then also, hey, you've got your whole mission in this nonprofit is to try to get people to train in trades. Let's see what we can do, and maybe train some kids from your area, I shouldn't say kid young. But people that would be maybe potential workers for us down the road. Can they come out, do some work, or can he run and crew to do some work, come up with some alternative solutions that maybe get replicated elsewhere? I think probably that's the right conversation to have next, because I don't think, and then at the same time, maybe you test something. Because it's not like this is a bad waiver. This is not bad waiver, right?
The whole thing about that is how does it work?
That's the question.
That's the unknown. It looks good and
Look.
they can, you know, but how does it wear with semi trucks doing that?
Sure.
It's the semis,
So,
semi-unitary basis.
Okay.
so my
Okay.
question is, so these roads have been around here for 60 years
Right?
and they got bad, but they haven't been bad. Because I haven't heard anything complain about long ago. I mean,
60 years ago, we weren't running semi trucks. down.
well, but single axle grand trucks can put about as much load on it if they're overloaded as a semi.
But not at 60 mile an hour.
But anyway, I don't think that. So when we did that road over there, talking over where it was, we ground that up, we packed it down. And I don't think I ever packed it ground before. But when they did the road, they just go in there and add rock and chip and seal it.
The difference though too, Bill, is back when you're talking about, it used to be pretty inexpensive to do chip and seal and to do what you're talking about.
Right,
The cost has skyrocketed, right?
right.
But also it's not just the size of the trucks. Look at how many more bushels we produce now than we did 60 years
Right.
ago.
But
So all those things, it's like, it's compounding.
Exponential growth.
Yes.
But the roughness of it is what they complain about. It's not, I mean, the base, yes, it's pretty much staying solid, but not every road up. There's one road we go on, when they first chip and sealed it, it wasn't even solid then. They tore it out and let it sit for a year, but they never did go back and really use a packer on it. And it stayed for quite a while, but now since there's more trucks going on, you can see it's falling apart.
You're getting the ruts in it.
Right,
Sure.
well, it had ruts in it from the very beginning because they graded it out, let it sit over the weekend with gravel and then they just chip and seal it. So they chip and seal ruts into it.
But Bill, sure, if I could, look, you're saying the right thing, okay? If you're down in, if I took you down to where I come from, down south central Kansas, and I go about 45 miles south of our farm, or where our farm, is, all right?
So what kind is that?
Howley County, right on the border of Oklahoma.
Okay,
All right? Say you get down there. I can show you roads that are just as minimum maintenance in western Kansas, and the ruts are so deep that I can't get a 2500 pickup through it without tearing the hell out of the axle. Right? You have to decide as a county, what level of road we want. Now, if we get out where they have no money, the east part of the state, we're doing much better. You get out west, it's bad. Like, if you go out west, the west part of our state is a very poor area. Okay? So you have to look at that, you have to understand the infrastructure to get goods to market, it's different. Now, they don't have rain. God did bless them. And so they can run on roads that are terrible. We have rain. You know, and if we have a significant event, we don't have some cap over the top. Things start to move out.
Mhm.
So out there, it's a different question. How they maintain what they do. They don't have a budget. You know, they're a third the size of this county. And the space of it. I mean, you go out to Cheyenne, and I'm not talking about Thomas, I'm talking about, if you go over to right up in this area. And you get south on, you get over here in Logan, right, or Wichita. That's all time. And they don't have a lot of bridges, but their roads are about the same, they're not even close. And so you gotta decide as a county. You have a different level of industry, you gotta have your trucks, and it's not just on the haul routes, it's not just the grain, you got cabinet maker. You got business here, I mean, there's a reason when you look at the map, there's just a lot more going on here than there is out there. And so it's not a bad problem, but you gotta first decide what level you want. And so, yeah, if you're gonna compact and you're gonna go down and you're gonna actually invest in the roads, you don't wanna throw a Band-Aid over the top without having a plan. Because if you do that, right, and you do that for another 10 years, you just wasted $30 million. So the goal is how do you not waste $30 million?
Well, plus, if you look at our budget right now. If this was a normal year and they were gonna do 90 miles of chip and seal, just the rock and the oils, $2 million, right? Rock went up 6%. Okay, oil right now, look at that. So just to maintain what we've been doing, we can't even afford. We can't. Because if within 3-4 years, it's 2.5 million to buy that same product, where's it coming from?
So does every road that we got oiled down need to be oiled?
That's part of it.
That's part of it, Bill. I've been asking that question. I know you guys have too. It's like, okay, we've been doing 90 miles.
Maybe not.
Maybe the magic number is 60 miles. I don't know.
But not, they're doing a chunk over a little period. And paying for it over a period of time, the bond issue, whatever, you said community development line, I'm not sure the intricacy of all that.
Right.
But trying to fix the cost and spread it out over time.
But look at this, guys, when you're talking about it, you're spending $2 million a year. for a budget. You spread that out over 15 years. Okay? Now, 15 years, $2 million budget, I'm not factoring in interest. Right? That is 250K. 120 miles per road. I think if we sat down and go down the county and say, hey, we've got up to 100 miles, finance this over 15 to 20 years. Right, the useful life on asphalt is it's 20 years, but you really got to 15 years, you get 20 years, and then you need to put some moisture on it. You gotta do some type of a story. And so you're gonna be budgeting for storage. If you come through here and break it down, I think we're gonna find out that we don't have more than really need to be budgeted. Better, and I know the county has a lot of miles of road. But I think you're gonna find out that we have less than 100 miles. We do a road survey. And this is probably the next big project that we have to.
And we've been talking about that, identifying what we believe to be our haul roads.
And I didn't ask Jerry because it rained. I know.
I know.
He's have the map in the backseat of the pickup.
Right.
But guys, I think if you've done this, get a handle on your budget, got an extra. Your budget, you're gonna get to a 5-year capital out. You're getting a handle on employment. You're staying in front of what's your staffing ratio. After this, you get this figured out, and then you gotta get your equipment on schedule.
Yeah.
This is normal. You're getting close to normal. Now, the problem with normal is normal with no reserve. So it's like, okay, I'm running along here without any extra coolant and gas tanks. So you gotta figure out what your reserve strategy is. Then you're in normal.
Yeah, well, even on our reserves, it's a subjective number, right?
That's right.
Now, I realize there are people, there are formulas that say you should have X amount of dollars in the total budget. I realize that, but that doesn't fit every county. But even if, as a commission, we say within 4 years, we would like to have X amount of dollars in reserves. You know, is that $500,000? Is it 400 or 700? But if we target that, then every year when we're doing our budget, we can say, what did we do to add to get to that $500,000 number in 4 years? Sure. And then at least when you go to coffee with commissioners and they start throwing stuff at us, at least we can say, this is what we are doing.
And when you do that, the good part is people ask people, what does it mean to not run the reserve? Well, what it means is that in any given year, I might have to increase your taxes 3 mils to cover the expected profit. And that's what having no reserve means. Right. And how do you do that? People ask, you issue a temporary note, you don't make any payments on it for 2 years, fund the problem, and then you raise taxes to go on ahead and cover it. And so what's happening is that by getting reserves, what you're doing is you're coming up with a way to not have to just chuck people's tax.
It also takes discipline, because if you got money in the bank, the urge is to.
But you can't, and I think if you're gonna, you have to, if you're gonna build reserve.
Yeah.
You have to, and whatever reserve you're gonna do. Right, you're gonna allocate a portion of whatever this would be my recommendation, strategic recommendation. You identify that on a separate line item. Cash for future reserves. Budget that and then plan that you're gonna do a capital improvement transfer at the end of the year. That way you've got the budget authority to spend it if you have an emergency, but then plan every year. This is a budgeted expenditure, you're gonna allocate it for future capital.
Okay, all right, well,
I'll leave it at that.
this has been excellent. Is a quarter till.
I got one question. You said something about the kick thing. What was that?
We're waiting to hear back from them.
On what?
They owe us a tribal,
Oh, no.
interlocal agreement for
Oh,
dispatch.
okay, I was talking about the.
But they put the money up first before they gave us what we needed, so.
So
it's
it's
like-
okay, we're all right.
There you go.
So this road thing, we're good to give that letter to them, right?
Do you know what he's talking about?
He's talking about, he's talking about the Kickapoo tribe contracted with a contractor who subcontracted to do directional boring, install fiber optic.
Right,
And the tribe is coming back and saying they didn't do it the way that they feel it was supposed to be done. So I'm going through,
What are you talking?
I'm going through,
I can.
basically the plans and the notes and trying to.
That's all right.
Oh, yeah, we signed it right here. Oh, you're so good. Thanks a lot, man.
How are we gonna get it to them?
I think what I would do is I would, I'd send it to the tribe, but I would also I'd send it to both of them and I'd just get contact information from the tribe. Okay, cause they've got the communication, they've got a way for us to talk to Bracy, I don't think. I don't. I think
I could take it down to the office and give it to them,
That's what I'd do, take a copy of it down there. Be less formal than more, I like it.
and just that one, that letter, right? Just
Yeah,
that,
that-
what we signed, and just,
Take the original here.
should I take original, you got a copy of it? You can. Well, you could copy it or leave
Yeah,
it,
I would get a copy of it, I bet Andy's doing it.
and I'll just take that down and give it to them in the morning and.
I'd do what I do.
Sounds good.
So one other question is the resolution that we're talking about extending this 7 days. You already did it.
Yeah, we just got it.
Was fine, but I want to be able to.
So this is a new proclamation or this? It's, well, it's resolution 2026-19. And it's named today and it goes for 7 days. Okay, well, I would make a motion that we, I guess, accept resolution 2026-19, which is declaring a state of local disaster emergency in Brown County, Kansas. From the 15th of June,
And I would just
extended it
note
for
that
7
it's-
days, yes.
And I would just know that it's an extension prior to motion. That's
And
fine.
which is an extension of the prior resolution. So that's my motion. Is it clear? Is there a second?
I'll second it.
Okay, it's been moved and seconded. Is there any discussion? Not all in favor, say aye.
Aye.
Aye. Okay, motion carried. That's fine. The other thing in front of me is a new employee, Virginia Wallachie, as a part-time senior taxi driver at a wage of $17 an hour. So I would make a motion to hire Virginia Wallachie at that wage for that position. Is there a second?
Second it.
Okay, it's been moved and seconded. Is there any discussion? If not, all in favor, say aye.
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 Okay, motion carried. And I think, is there any other business to come for us? Will I sign this one for her as department? Okay. All right, if there's nothing else, I guess we do meet here at 9 o'clock on Thursday, if I'm looking at that right. 9 to 5 on Thursday for the first round of budget with Woodruff.
If you guys need anything else from me right now, obviously, I think I'm done with my work on the special project, that's the, car sale.
Okay.
I sent a text to the sheriff letting him know the hard time and date. And asking, making sure he will be there to do the auction. He said he would.
Good, outstanding.
Okay.
We got a hard time today on that. Anything else that you guys need from me right now? If not, I'm gonna regroup a little bit. I'm working on the bridge, situation. I may run some numbers on roads. Here a little bit, try to come up with some thoughts.
I had an email from the soybean group. Did you guys, I forwarded that. You got it.
She forwarded.
Okay, so I ought to forward it to you too, so you have the information. I talked with them, or I speak with them this Friday about, that's all right. I speak with them on Friday about trying to move this on, and there's some definite expense to having this consultant out of Iowa take a look at it. Hopefully the soybean group covers part of that. I think that's the plan, so.
If we've got another, I can go to the Anthony Foundation maybe and ask if they have some interest in all, but we're a little outside of their territory, but I'll see. Okay. With that, you guys need anything else from me this week?
I just got one more question. I don't know if you need
Yeah.
here, but Richard, you said he's going over that contract with him. What did I tell him about that? That, so they can contact you if they want
Yeah,
information?
sure, give them my number.
Okay.
So basically, when they asked for us to give them a letter to support, I simply said, before we can support it, just because they're saying that the conduit isn't where they want it, the box is not, they want, we gotta see what was presented to the contractor. So they gave me basically the plans and general notes. So I'm just going through to see if there was specifications on placement, you know, how far outside the traveled roadway a box could be sent, all those kind of things. I was gonna make some notes up. Just as if it was going into like a mediator, where, you know, like a claim, like a normal claim.
I think that if anybody could, I think that you look at general notes and placement and figure out whether or not that it's done for spec. So for a conduit line, I have a feeling that you're far better than anybody else. So,
Well, I'll give it my best shot.
all right, guys.
If there's no other, thank you, Austin. If there's no other business in front of the commission, is there any? I don't want to rush away. Do you have something? Go
I
ahead.
don't know if it- I'm taking that letter down and I'll tell them that they can contact you if they want.
Sounds good. Thank you.
Sounds good. Well, then, if there's no other business, is there a motion to adjourn the meeting? I'll make a motion, we adjourn the meeting. Is there a second? Second. Okay, it's been moved and seconded. All in favor, say aye.
Aye.
Aye. We're adjourned. Good job.
I'm on some car. She's out there.
Oh, really?
I'm doing okay, so I want to go out.
I hope you left it running for her.
Oh,